Hello everyone, thank you for logging on with us today. We're just going to wait a few more moments to wait for a few more folks to sign on. Thanks. Hi everyone, welcome to the TBR Webinar series. Today, Senior Analyst John Caucis will be discussing Pivoting to Value, Healthcare IT Services Vendors Align with Market Shift to Value-Centric Care. Before we get started, we have a few housekeeping notes. At the bottom of your screens, you'll see a series of buttons. From left to right, you can access the slides, audio controls, Q&A, speaker bios, and our survey. After the event, you will receive an email with the replay link as well as a link to view other TBR webinars. If you have any questions for us, please submit them via the Q&A widget in On24. You may also reach out to us after the event at webinars@tbri.com. Thank you again for joining us. Here's John to begin the webinar.
Thank you, Sarah. Hello, everyone, and welcome to TBR's Healthcare IT Services Benchmark Review for the fourth calendar quarter of 2017. As Sarah mentioned, my name is John Caucis, and I'm the lead analyst in our Healthcare IT Services Research Program at TBR, and I'll be today's presenter. Our focus, TBR's focus within the Healthcare IT Services market, is to provide a view of the market as seen through, as we call it, the company-centric lens. In essence, what we do is we develop our view of the market by tracking and analyzing the activities of, in this case, in the case of Healthcare IT Services, 20 companies that operate within the healthcare IT services space. And as you can see on the slide here, this is kind of a summary of the Healthcare IT Services Research Program. We gather quantitative as well as qualitative information on these companies. We compile that into our quarterly benchmark. We provide details around vendor strategies, strategic actions, key developments during the quarter, things such as alliance and acquisition activity, new portfolio introductions, new solutions introductions into vendor portfolios, and overall fiscal and business line performance for the vendors that we follow. So today, as I mentioned, I'll be summarizing the results from our most recent Healthcare IT Services benchmark, which published a few weeks ago on April 13th and covered the fourth calendar quarter of 2017. So we look forward to receiving your feedback and responding to your questions about the information that I'll cover today. So with that, we're going to focus on three primary topic areas today. First, I'll provide an overview of the Healthcare IT Services market and the key dynamics, the key market dynamics that influence vendor fiscal performance, including revenue growth and profitability. Then I'll focus on talking about how Healthcare IT Services vendors have responded to the evolving Healthcare IT market with changes to their portfolios, acquisitions that they've made, and new alliances that they've forged. And then finally, I'll have comments on the outlook for the overall market for the remainder of 2018, and then take your questions at the end. So let me take a moment to orient everyone to the illustration here. The two upper lines on this graph represent the average total year-to-year growth for the healthcare IT services firms for the 20 companies in our industry benchmark. The lighter shaded green line illustrates the average total year-to-year growth for these companies, while the darker green line is also an average of year-to-year revenue growth, but we weight this to account for the size of each benchmark company's respective revenue base in healthcare IT services, and then we calculate that on a trailing 12-month basis in order to essentially smooth out seasonal factors, but also to moderate the impact of acquisitions. We've also included the lowest line on this graphic, which represents the data from our global IT services benchmark, growth data, as well as projected growth for the global IT services market for the upcoming quarter. And we include this to illustrate the comparative growth of the larger IT services market against its smaller healthcare vertical within that. So we also provide in this graphic projections for these growth rates for the first calendar quarter of 2018, which wrapped up a few weeks ago on March 31st. We've already begun tabulating fiscal data from this quarter. We'll continue to do so over the next few weeks in preparation for the next quarterly benchmark, which we expect to publish in late June or early July. So what we observed during 2017 was a steady deceleration, as you can see on the graphic, in aggregate healthcare IT services growth. Several factors behind that. First and foremost, really, a lack of a viable legislative resolution to the reform process for the Affordable Care Act, the ACA. And this really served to generate significant downward pressure, primarily in the healthcare payer sector. There was some limited impact in the provider market, but this was the case essentially throughout the year, throughout 2017. When we got to the third quarter, the natural disasters, the hurricanes Harvey, Irma, and Maria, as well as earthquakes in Mexico, had an additional impact on overall growth rates. And all of this, the confluence of this, really created some significant headwinds for the companies that we track in terms of growth. But we're starting to see the market turn the corner. The impact of these aforementioned events has begun to diminish. Vendors are reporting some stabilization in the U.S. health insurance market, but the process, as I'll note several times today, is progressing rather slowly. There's also still a lot of uncertainty about the timing of the broader market shift to value-focused care delivery and value-focused compensation for care. But these factors are also starting to kind of give way to greater clarity on behalf of stakeholders across the healthcare continuum about the need to really accelerate spend on emerging healthcare IT solutions to drive higher quality, patient-centric care and improve overall operational efficiencies. So, with that, let's move to our first poll question today, which is, which of the following 5 healthcare IT services vendors, Allscripts, Athena Health, Epic Systems, Cognizant, Tata Consultancy Services, TCS, which of these 5 do you believe grew the fastest in the fourth calendar quarter of 2017? We'll have the answer for you on the next slide, and we'll give everyone a moment or two to provide an answer to the question. Okay, I hope that everyone has had an opportunity to answer our poll question. Let's take a quick look at the answers. And Epic is in fact the vendor that I believe generated the strongest growth rates during the quarter. But these were actually these 5 vendors were our leading vendors overall in rank order, and I'll discuss that now as we move to the next slide. So a couple of comments to orient you to the illustration here. What we have here is an illustration of the 20 firms in terms of their relative positioning against one another, the 20 firms in our benchmark, in terms of top-line growth, margin performance, and the respective size of their healthcare IT services revenue base. In essence, what this illustration shows is who's growing and who's growing the fastest and who's growing most profitably. And I'll spend a couple of minutes at the end of the slide here talking about the drivers behind the performance of the growth and margin leaders here. But in terms of the axes, the x-axis is the absolute dollar growth of each vendor's healthcare IT services business, while the y-axis represents the reported or estimated operating margin for each of the vendor's healthcare IT services business. And then, as I mentioned, the size of the bubble really represents the volume of revenue globally generated during the quarter through healthcare IT services activities. So, providing additional context, we've plotted the average trailing 12-month growth with the vertical dashed red line, which is 3.3% in the fourth calendar quarter, and also we've provided the average operating margin with the horizontal line, red dashed line, which is 11.9% in 4Q17. So, as I mentioned after the poll question, the growth leaders, in terms of trailing 12-month growth, were in fact in rank order: Epic, Allscripts, Athena, TCS, and Cognizant. So let me take a few minutes to discuss the reasons why. Epic continues to ramp up several recent large-scale EHR implementations. And when I say recent, I'm talking about essentially the throughout 2017, but there were a number of them that they landed in the second half of the year. They continue to expand overseas, and they are seeing increased value add-ons with their population health management, PHM solution, and their MyChart patient portal. Allscripts, it's all about acquisitions with Allscripts. They continue to integrate McKesson Enterprise Information Solutions. The inorganic revenue from that acquisition hit its top line, or began to hit its top line in 4Q17, and this served to augment the impact of other acquisitions they've made as of late. And I'll talk about this in more detail in a few minutes. They acquired Practice Fusion during the quarter, and we expect the inorganic revenue from Practice Fusion to accrue to Allscripts' top line beginning in the first calendar quarter as we tabulate the results for the first calendar quarter of 2018. And as a result, we expect that Allscripts will remain one of the growth leaders in the benchmark and may, in fact, close the gap with Epic as we move through 2018. Athena Health has seen their growth decelerate during 2017. They kicked off a restructuring program, operations as well as portfolio, to kind of reposition in better alignment with the dynamics in the market. But they do remain one of the growth leaders in our benchmark. They continue to add new provider systems, new provider networks that use their Athena One solution. They did realize surprisingly strong bookings in the fourth quarter with independent medical groups, actually not just in the fourth quarter, but throughout the latter half of 2017. They've been less acquisitive than in recent years, but in the third quarter they acquired Praxify, and that began to provide an inorganic boost to their growth in the fourth calendar quarter of the year. With respect to TCS, they continue to see strong growth in their health and life sciences segment. A lot of this is being driven by increasing adoption of their social media analytics, I should say, solutions, as well as their cognitive solution, Ignio, by healthcare organizations. And we do have additional detail on TCS globally, but as well as in the healthcare and life sciences space in our Global IT Services report on TCS. So I would point anyone to that if you'd like to see more analysis around them. The same holds true with Cognizant. Cognizant has been acquisitive. They continue to be in the first calendar quarter. Last year they acquired TMG Health and Top Tier Consulting, and in March of this year they acquired a company called Boulder Healthcare Solutions. So, all of this together really illustrates to us that Cognizant is essentially hell-bent on expanding and driving growth out of the healthcare space. Healthcare is a strategic growth market for them. They place a tremendous amount of importance upon healthcare as a strategic growth opportunity. In terms of margin performance, in rank order, the leaders were Infosys, TCS, HCL Technologies, Cerner, and Cognizant. Without diving in, for the sake of time, without diving in too deep here, I would direct everyone to our benchmark report where we have much more analysis around their margin performance specific to each of the vendors. But a common thread across the 5 of them with respect to profitability and margin performance was the continued implementation of automation in their service delivery frameworks. This is certainly the case with Infosys, with TCS, HCL, and Cognizant. They're also seeing accelerating adoption of more lucrative digital-centric services offerings. And as I mentioned, additional detail, we can certainly dig into if there are questions about, what some of the margin drivers for these vendors or any of the other vendors in our benchmark. We can certainly dig into our benchmark report for you and provide that. So let me shift gears from financial measures to talk about what the vendors that we track are doing with their portfolios. What are they doing with their alliance networks? What are they doing with respect to acquisitions to adapt to the changes, to the dynamics in the healthcare IT services market? Certainly the common driver behind all of this is the inevitable industry shift, industry transition to value-based frameworks for care and payment. Beginning with M&A, we've really seen a deceleration in the volume of M&A activity, at least within the subsegment of the market that we track, although taking a broader view of healthcare IT, it is still a fairly robust M&A market. We do have, once again, some detail around that, although it's not really the focus of our benchmark report beyond the 20 companies that we cover. But within that subsegment in 2015, 2016, the companies we follow very, very active in terms of acquisitions, especially strategic level acquisitions. That has diminished. That slowdown continued throughout 2017. The overall pace of healthcare IT of acquisitions by the healthcare IT services vendors has slowed, but there were still a few notable purchases during the quarter that I want to highlight. Mentioned Allscripts a moment ago. As they're integrating, and it's a fairly large integration, several $100 million. McKesson's Enterprise Information Systems Group. They subsequently bought Practice Fusion, which expanded their footprint in the ambulatory market and added Practice Fusion's really robust cloud-based EHR platform to the Allscripts portfolio. And this platform is designed for small to mid-market physician practices. According to Allscripts, they paid about $100 million in cash for Practice Fusion. So this, in our view, really rises to the level of another strategic acquisition. Allscripts, and it illustrates Allscripts' strategy to really pivot away from the EHR base. I mean, they and several of the other EHR-centric vendors are still seeing a fair amount of EHR activity, especially around replacements. We'll talk about that in a few minutes. But they are also pivoting their portfolios now to align with a post-EHR world. One vendor that really jumps out, and this is not just in a healthcare context, but also in a global IT services context, is CGI. I mean, they've been very, very acquisitive over the last 12 to almost 18 months now, really trying to reinvent themselves as a consulting-led, vertically centric IT services competitor. And between the first quarter of 2016, so now we're talking almost 2 years, and last quarter, or I should say the fourth quarter of 2017, they've made 8 acquisitions. They've added over 2,000 employees. They've added a couple $100 million in inorganic revenue to their revenue base. And in the fourth quarter of last year, they added Paragon Solutions, which is a New Jersey-based consultancy. Their principal focus is on the healthcare and life sciences market, and within that, we really see a heavy focus on life sciences. The acquisition brings 300 or so consulting professionals into CGI. According to our analysis, between 55 and 60 or so million dollars in annual revenue. It's a real boost. It's really going to help CGI to jumpstart a healthcare practice that has struggled to regain its footing and mend its market reputation following the healthcare.gov situation back in 2014. So when we take a closer look at Paragon's portfolio, at their capabilities, it indicates to us that Paragon really has strong IT and management consulting capabilities across the subsegments of healthcare, provider, payer, and life sciences. But as I mentioned, the bulk of their activity, the bulk of their solutions and advisory focus is really on the life sciences sector. So even though the integration path for CGI and the end result remain unclear, we see this as being an excellent acquisition for CGI. It's really, as I mentioned, it's going to kickstart their healthcare business. It's going to move the needle for them in terms of revenue, in terms of reputation. It gives them a really good boost in the life sciences space, where we have seen a lot of activity, especially on behalf of somebody like an Accenture, who has made acquisitions there to enhance their standing as well. So CGI is serious about rebuilding their healthcare business. They're already very strong in the federal IT market. Now they're looking to broaden that out, not only in federal health IT, but in overall healthcare IT as well. So finally, in terms of M&A, I mentioned earlier, Cognizant acquired TMG Health, and this really gave them a boost in terms of their portfolio boost in terms of Medicare Advantage, Medicare Part D, Medicaid managed care plans for the healthcare payer market in the U.S. When they signed the acquisition, when they consummated the deal, they did also obtain a significant outsourcing contract with TMG's parent company, which was Healthcare Services Corporation. And then, as I mentioned, they've gone forward and made another acquisition, healthcare-specific acquisition with Boulder Healthcare Solutions. We will have detailed analysis of that transaction in the upcoming Cognizant report. Cognizant releases their earnings on Monday. For those of you, and I hope everyone's subscribing to our Cognizant report, you will find an initial analysis in our initial response, and then in the full report that comes out 2 to 3 weeks later, we'll have a much more detailed analysis of that acquisition, because it's really important to focus on what Cognizant has identified as I mentioned earlier, a strategic growth opportunity for them in healthcare. So shifting gears to alliances, during the quarter, a couple of key alliances stood out. Cerner's partnership with Amazon Web Services, AWS, really set up to enhance the capabilities of Cerner's Health Intent PHM, Population Health Management Platform, with AWS's Cloud Advanced Analytics and Machine Learning Solutions. They already partner with AWS in storage and in database solutions, and disaster recovery. But this alliance, certainly benefits Cerner from the AWS perspective. But the flip side of that coin for AWS is now they're able to hitch their wagon to Cerner's really extensive EHR install base. They've got a dominant market share in the U.S. and they're expanding overseas as well, so they can follow Cerner to these emerging markets and capture the opportunities there. So it's a good symbiotic relationship in our view for both companies. A couple of additional alliances that we think illustrate some key developments. IBM and the CDC, the Centers for Disease Control, launching a pilot program to explore blockchain use for storing medical information. This really illustrates a couple of things. IBM trying to accelerate their growth in the federal health IT market, but also they've identified blockchain as kind of the next wave of growth within their overall healthcare business, which of course includes Watson Health. So we expect to see a lot more focus on behalf of IBM in terms of healthcare and blockchain. I'll also mention Epic's collaboration with Cvs Health. CVS is going to leverage Epic's analytics solution, analytics-rich population health solution, Healthy Planet, in an effort to drive down prescription drug costs and enhance visibility into medication adherence rates. Now, you may be wondering, what about CVS and Aetna? If there is interest, we did publish an analysis, a brief 2 or 3-page analysis on that transaction a couple of months ago. I'm happy to provide that to everyone, but it's just the latest, or it was at that time the latest. There have been subsequent transactions since that illustrate the vertical integration that's happening among not only amongst payers but PBMs and pharmacy outfits, et cetera. So it's something we expect to continue. So let me then wrap up on this slide with a couple of comments about new solutions. Accenture and IBM come to mind when looking at the activity during the quarter. Accenture's Patient Experience Manager was introduced at Dreamforce back in November in San Francisco, which is Accenture's analytics platform for life sciences companies, and this ties in with my earlier comments about the additional activity that we've observed over the last year on behalf of Accenture within the life sciences sector. This solution is also part of Accenture's intelligent patient platform. It's fully integrated with the Salesforce Health Cloud, and it's really set up to enable pharmaceutical researchers to make real-time evaluations of patient data from a number of different sources, clinical and adjacent sources. So IBM is pairing its machine learning technology with a risk scoring methodology known as the Model for End-Stage Liver Disease, and the intent here is to enable clinicians to prioritize patients waiting to receive liver transplants. So, more evidence on behalf of IBM. A key element in IBM's overall strategy is that alliance network, is that partnership network. Not only from the perspective of working more closely with developers, but enhancing the number of avenues that will provide patient data, patient information, and outbound solutions to clients using Watson Health and solutions to patients ultimately as well. So there were many other developments during the quarter in terms of alliances, acquisitions. Well, not so much in terms of acquisitions, but alliances and new solutions, and we have that covered in more detail in our benchmark report. So with that, I want to move to the last section of the webinar today, where we provide our outlook for the healthcare IT services market for 2018 and beyond. And we see a continued and a steady expansion of the market, not only in 2018, but in fact through 2024. I see that a question has come up. Oh, no, I'm sorry. It was a message from one of my colleagues. And we will have questions in just a few minutes after I make my comments on the outlook. So the impacts on the market in 2018, there seems to be, among the vendors that we track, a growing consensus that the U.S. payer sector turmoil has bottomed out, or certainly will bottom out by the middle of this year. But this has also been accompanied by almost like a tacit acknowledgement that the improving IT spending patterns among insurance companies are going to take some time to develop. We don't expect a protracted downturn in the U.S. payer market, and we don't expect the downturn that we've seen to continue past the middle of this year or even the third quarter of this year. We don't expect any lingering market softness will impede the fiscal performance of the vendors that we track, particularly those that are more diversified across multiple segments, though companies like Wipro that have a high exposure to the payer sector without the offsetting diversification into the provider or other markets may see some softness in their healthcare revenue, as they've seen throughout 2017. They may see that continue into 2018. In terms of solutions, revenue cycle management is really what's in vogue right now, and expected to be throughout 2018. Managed solutions for billing and collections. We see more demand for consulting services, advisory services around improving revenue cycles to curtail revenue leakage at provider organizations. And we're seeing an increase in the pressure that their payer counterparts are putting on them, to control costs, to minimize revenue leakage, as well as to adopt solutions to improve the overall workflow within the hospital environments. Over in the life sciences segment, we see life sciences organizations continuing to accelerate their investment on solutions that in turn accelerate the development of and enhance the economics of new treatment programs. And we believe that even though there has been some deceleration in growth that we observed during the course of 2017, we do see growth turning the corner and accelerating and likely being sustained in the mid to upper single-digit range during 2018 within the sub-segment of the companies that we track. Population health management is just as much in vogue as revenue cycle management. No sign of demand slowing down there. We anticipate increased activity around PHM overseas within the vendor set that we track. Growing order books of solutions around platform as a service offerings and digital modernizations. These are also going to be growth engines for many of the vendors that we follow. We expect to see continued consolidation activity among provider organizations in the U.S., and as a result, we expect that this will help to sustain a fairly healthy pace of EHR modernization as well as EHR replacement work during the year. And then finally, looking a bit further out as we look to 2019 specifically, we believe that the changes to the federal tax code that were recently implemented may create some additional pressures on provider budgets that are already under tremendous pressure. And this would come in the form of, as the penalties on individuals for not having health insurance coverage will be rescinded or expected to be rescinded in 2019, we believe that this could in turn lead to an influx of uninsured patients into healthcare systems, or patients that have perhaps suffered an injury or are suffering from some sort of an infirmity, but they've initially foregone preventative care or initial care, and they've chosen to wait it out until the problems got to a point where they could no longer ignore them, and they were compelled to seek out clinical attention. If that is the case, and a handful of vendors have cautioned against that, that could create some additional pressure on provider spend in the upcoming year. So with that, that basically wraps up our webinar, and with that, we'll shift over to take your questions. Okay. So I have our first question. You mentioned that overseas expansion by the vendors that you track. You mentioned overseas expansion, I should say, by the vendors that you cover, though most seem focused on the U.S. market. Which international markets appear most active right now? Thanks for the question, and that's a great question, by the way. We have noted an increased volume of activity in Australia over the last really 2 years, and we expect that to continue. One of the drivers, in fact, probably the biggest driver behind that, is the strong commitment that the government there, and not just the overall government, the provincial governments have expressed to investing to modernize the healthcare IT systems across the provider networks. For example, I believe the Queensland government plans to spend upwards of $130 million to upgrade and install new health IT systems within its regional health services beginning this year. And if memory serves me correctly, the overall market in Australia is expected to sustain a double-digit compounded growth rate over the next couple of years, and near between $1.5 and $2 billion in total market value during that time. We've seen Accenture, Allscripts, Cognizant, DXC Technology especially increasing their activity around Australia. However, one challenge that these folks are running into is local health IT vendors who obviously have more experience, more trigger time working in that market, and have more experience custom tailoring solutions to the various dynamics of that market. And this is creating, I think, only short-term advantages for them, over these outside competitors, who are still trying to figure out how to translate their products and solutions to accommodate the, the needs of Australian health IT end users. So, again, thank you for the question. I do have another question. You discussed continued demand around EHR implementations and replacements in your presentation, but isn't the U.S. EHR market essentially fully mature at this point? Thank you for the question. Yes, I agree. The short answer is yes. But while I do agree that the U.S. EHR market is approaching full maturity, as it transitions into an environment, a post-government stimulus environment, the vendors that we follow have also indicated that they're still seeing fairly solid demand levels for EHR upgrades and replacements in the U.S. But this said, these same vendors continue to accelerate the development of post-EHR platforms, platforms that will cater to demand for demand in a post-EHR world. For health systems, we see vendors kind of reorienting their service around improving client experience, for example, reducing administrative burdens, overpayments, coding-related, patient-related insurance claim denials, for example. Machine learning technologies are being brought to bear on more and more back-office tasks, processing, analyzing faxes of patient records, for example. Certainly analytics. I mentioned blockchain and IBM earlier, and IoT technologies. Vendors that are providing solutions for these technologies in other industries are looking for ways to repurpose these technologies for healthcare sector applications. An example I'll cite there is CGI with their Trade 360 platform, and you can certainly read more about that in our CGI reports. Or please send me a question, and I'd be happy to dig into that further. So, again, thank you for the question. Okay, we have another question here from in regards to the Chinese market. Do you anticipate a spike in China at some point, given the large proportion of elderly population versus a lower proportion of youth, given the former one-child policy? Yes. I can't say that we have seen that emerge within the performance or within the activity of the vendors that we track. But it is something that we have, there has been discussion about that. The expectations not only with us, but with others as well, and in the the market research side as well as the vendor side, is that that's going to be the case. When it's going to happen, I'm uncertain at this point, to be honest with you, to be completely honest in that regard. But it is something that we are keeping track of. So thank you for the question. We have another question coming in. What is my reaction to the HIMSS conference back in March, HIMSS 2018? Thank you for this question. I was there. We did put together an event summary, which I'm happy to share. Please email me, and we'll get you a copy if you're interested to see it. We put this out a couple of days after I returned from the event. The biggest HIMSS ever. Lots of shiny new and really incredible solutions were on display there. But you know what? When I had the opportunity to chat with people there, not only in the companies that we track, but in other companies, as well as people on the provider side, there was almost an undercurrent, if you will, of frustration. And this was in regards to the interoperability problem. It's still a significant challenge across the healthcare sector. And unfortunately, many of the people that I spoke with suggested that we're still several years away, 10 or more years in a handful of cases, from really solving the problem and achieving more ubiquitous interoperability across the segment. So I would expect that interoperability is going to continue to be a hot topic at HIMSS for several years to come. So I do appreciate the question. Okay, do we have any additional questions? A year from now, we do have one. A year from now, what's going to be the biggest change in the sector, either a vendor changing or some aspect of the market, such as demand or new offerings? Well, I mentioned, revenue cycle management and population health management earlier. Those are going to be areas of investment. More personal, solutions that help to personalize care delivery, care for patients, solutions that really move care towards a more retail-oriented focus are going to be in vogue. Precision medicine is an area where I expect to see additional focus and additional development as well. As we get closer and closer to that still yet to be determined, go live date, if you will, for value-based care, population health management, revenue, controlling and the revenue cycle will remain key challenges and the key focus of investments a year from now. I fully expect that to be the case because in many organizations, the level of maturity of adoption is still very, very low. So, and that the evidence of that is you could see the vendors that we track really turning their attention to those areas in terms of acquisitions, alliances, new solution development. So thank you for that question. Okay, I don't see any other questions in the queue. Sarah, do we want to wrap at this point?
Yep, sure. All right, everyone, please feel free to reach out to the team with any follow-up questions. If you have a few moments, please fill out the survey on your screen and let us know what topics you'd like to see us cover in the future. A replay version of the webcast will be available after the event, which you will receive via email, as well as a link to view and register for other TBR webinars. Be sure to join us next week on May 9th for The Door to Vendor-Led Digital Transformation is Wide Open. Thanks for joining and have a great day.
Thank you, everyone.